Hey everyone. Today we're diving into a topic that's literally at the core of who you are, the anterior abdominal wall. Now that might sound like some complicated medical jargon, but stick with me. In simple terms, it's the front part of your belly. Think of it as the flexible, multi-layered shield that stands between your vital internal organs and the outside world. Its purpose is incredibly important. It covers and protects everything packed inside your tummy, from your stomach to your intestines. But it does so much more than just stand guard. It's a dynamic structure that helps you move, bend, breathe, and even cough. Understanding this wall is not just for doctors or medical students. Knowing how your own body is built helps you understand what's happening when you feel pain, why core exercises are so important, or what a doctor is talking about when they mention a hernia. We're going to break it down simply. Ready? Let's go. Before we get into the soft tissues like muscles and fat, we need to understand the skeleton that provides the anchor points for the abdominal wall. Think of it like building a house. You have to start with a solid frame. The bones that surround the abdomen create a sturdy boundary, giving muscles a place to attach. These bony landmarks are not just abstract points. You can actually feel most of them on your own body. At the very top, the abdominal wall is bordered by the rib cage. Feel the lower edges of your ribs. They form a downward V shape. That V is the costal margin. In the center of the V at the bottom of your breastbone is the xiphoid process, a small pointed cartilage you can feel in your upper abdomen. This upper boundary separates chest from abdomen. Moving down the sides, the next major landmarks are the hip bones. The top curved edge you can feel is the iliac crest. Put your hands on your hips. That's the iliac crests. Now that we know the bony frame, let's talk about the landmarks you can see or feel on the surface of the skin. These are like the GPS coordinates for your abdomen, helping you navigate and locate what's underneath. The most obvious landmark is your belly button, the umbilicus. It's more than a leftover from birth. It's a key reference point. Doctors use it to divide the abdomen into 4 quadrants: upper right, upper left, lower right, lower left, which helps describe locations with precision. Running down the center is a faint fibrous line, the linea alba. Linea alba literally means white line. In pregnancy, this line can darken and become the linea nigra. The linea alba is fused connective tissue from both sides. It stretches from the xiphoid process at the top down to the pubic symphysis at the bottom. On either side, you can see the rectus abdominis outline, the famous six-pack in athletic people. The horizontal grooves are caused by tendinous intersections. The muscles run vertically from your lower ribs to your pubic bone, providing strength for bending forward. Now we're getting to the real powerhouse of the abdominal wall, the muscles. There are 3 broad flat layers of muscle on each side of your abdomen stacked like plywood. This layered construction gives strength and support from multiple directions. Remember their names and fiber directions. External, oblique, external, round, outside. Oblique, round, angled fibers. Fibers run down and in, inferomedially. Imagine your hands in your front pockets. Fingers point the same way. Both external obliques contract. Bend forward one side, bend spar and soft for one side. Bend sideways and rotate the trunk. Go 1 layer deeper, internal oblique. Internal to external, also angled fibers. Fibers run up and in and superomedially. They run at right angles to external oblique. Moder cross-trace. Cross-hatch pattern. Cross-hatching gives the wall its strength. Internal works with the opposite external to twist the torso. Twist right, left external plus right internal. Deepest, transversus abdominis. Fibers run horizontally like in spatsum brats, iberdesen, satsen, fibrosami oberzai, like a corset or weightlifting belt. Its job is compressing abdominal contents, not moving the trunk. When you cough, sneeze, laugh, or lift something heavy, it contracts to increase abdominal pressure. This Valsalva maneuver stabilizes the spine and helps with childbirth and with having a bowel movement. Together, these 3 layers form a strong dynamic container for your organs. While the 3 flat muscles form the sides of the abdominal wall, there's another pair of muscles located right at the front and center, the rectus abdominis. This is the muscle everyone knows and talks about, the one that forms the six-pack in very fit individuals. Rectus means straight. A long strap-like muscle that runs vertically on either side of the midline linea alba. It originates from the pubic bone at the bottom and inserts onto the lower ribs and the xiphoid process at the top. The rectus abdominis isn't just one long, smooth muscle. It's interrupted by 3 or 4 fibrous bands called tendinous intersections. These bands create the segmented look of a 6-pack, or sometimes an 8-pack. They fuse to the sheath that covers the muscle, tethering it and dividing it into smaller sections. The primary function is to flex the trunk, the motion of a sit-up or a crunch. It pulls your chest toward your pelvis, bending the spine forward. A crucial part is the rectus sheath, a fibrous compartment formed from aponeuroses, the flat tendon-like extensions of the obliques and the transversus abdominis. These aponeuroses travel to the midline, split, and wrap around the rectus abdominis, forming a protective sleeve. That sleeve fuses in the middle to form the linea alba. The sheath changes from upper abdomen to lower abdomen. In the upper 2/3, the muscle is fully enclosed, with layers in front and behind. In the lower third, all 3 aponeuroses pass in front of rectus abdominis. Only a thin fascia remains behind, creating a potential weak spot. That transition is marked by a curved line, the arcuate line. Understanding the rectus sheath helps explain surgical approaches and why some hernias occur. Well, that's the basic anatomy and function of the rectus abdominis. Section 6. The layers of the wall, a journey from skin to organs. So far we've looked at the bones and the individual muscles. Now, let's put it all together. We'll travel from the very outside inward to the organs. Thinking about the wall as distinct layers helps. For surgery, or injury, there are 5 main layers you need to know. Skin, superficial fascia, Camper's fascia, the fatty layer, Scarpa's fascia, the deeper membranous layer. The amount of fat here varies between people. This layer contains superficial blood vessels and nerves. It provides insulation and padding. The third and most substantial layer is the muscular layer. External oblique, internal oblique, transversus abdominis, rectus abdominis, inside its sheath. These muscles and their aponeuroses do the heavy lifting, protect organs and support posture. The fourth layer is the transversalis fascia. It lies deep to transversus abdominis and lines the abdominal cavity. Behind this fascia is extraperitoneal fat, a final cushion. Finally, the 5th layer is the peritoneum, a thin slippery membrane that lines the cavity and wraps organs, letting them slide smoothly. Section 7, the inguinal region, a critical weak point. Now let's focus on a small but incredibly important area of the anterior abdominal wall, the inguinal region, more commonly known as the groin. This is the area at the junction of your abdomen and your thigh. Anatomically, it's defined by the inguinal ligament, that band running from the bony point of your hip, the anterior superior iliac spine, to your pubic bone. This region is a natural weak spot in the abdominal wall, and it's the most common site for hernias. The reason this area is weak is due to our development. In males, during fetal development, the testes descend from inside the abdomen down into the scrotum. To do this, they pass through the layers of the abdominal wall, creating the inguinal canal. This canal contains the spermatic cord in males and the round ligament of the uterus in females. Although it normally closes, the canal remains a weaker pathway through the muscular wall. This inherent weakness makes the inguinal region susceptible to hernias. An inguinal hernia occurs when abdominal contents, usually a loop of intestine or fatty tissue, push through this weak spot, creating a bulge under the skin. The bulge becomes more noticeable when you cough, strain, or lift something heavy. Men are far more likely to get inguinal hernias than women because their inguinal canal is larger to accommodate the spermatic cord. Section 8. Clinical connections. When the wall has problems. Understanding the anatomy of the anterior abdominal wall isn't just an academic exercise. It has huge real-world importance in medicine every single day. One of the most common clinical issues, as we've discussed, is hernias. Besides the inguinal region, hernias can also occur at other weak spots, the umbilicus, an umbilical hernia, and the linea alba, an incisional hernia. Surgeons who repair hernias need expert knowledge of these layers to perform a strong, lasting repair. Surgical incisions are another major clinical connection. The choice of incision aims to give good access to organs while minimizing damage to muscles, nerves, and blood vessels. Many surgeons prefer a midline incision through the linea alba. The linea alba is relatively avascular, so it bleeds less. It also avoids cutting major muscle bellies, enabling better healing and less post-operative pain. But it must be closed properly to prevent an incisional hernia. Trauma to the abdomen is another area where this anatomy matters. With a stab or penetrating injury, clinicians must judge how deep the wound is. Skin and fat, muscle layers, or through the peritoneum. Knowing the layers helps plan treatment, which ranges from simple wound care to emergency surgery. Section 9, Summary and Memory Trick, tying it all together. We've covered a lot of ground, but let's boil it all down to the essentials. The anterior abdominal wall is the protective, flexible front of your belly. It's framed by your lower ribs, hip bones, pubic bone. Its strength comes from 3 layers of flat muscles on the sides, external oblique, internal oblique, transversus abdominis, and a pair of straight muscles in the front, rectus abdominis. These muscles allow you to bend, twist, and stabilize your entire trunk. The wall is constructed in 5 distinct layers, like a well-engineered piece of armor. From the outside in, skin, superficial fascia, muscles, transversalis fascia, peritoneum. The inguinal region, or groin, is a natural weak spot. Hernias commonly occur there because of the passage of the inguinal canal. This anatomy is vital for doctors to diagnose hernias, plan safe surgical incisions, and treat trauma effectively. For you, it explains why core strength protects your back. Now a simple memory trick to recall the 5 layers from superficial to deep. Remember this silly sentence. Some fat men must try pants. That stands for skins. Skin. Fascia. Superficial fascia. Muscle. Transversalis fascia. Peritoneum. For the 3 side muscles, think external sandwich, internal filling, transverse plate, EIT,